Good afternoon, ladies and gentlemen. It is my pleasure to welcome you to this event on behalf of the UN Programme on Aging. At the outset, I'd like to take this opportunity to express our appreciation to the Stakeholder Group on Aging, who serve as the voice of older persons at the global level, for organizing this event. We're also very fortunate to have Ambassador Moritan, the chair of the Open-Ended Working Group on Aging, with us today, as well as Paul Ladd, director of the UN Research Institute for Social Development, who joined us, and we thank him for agreeing to moderate today's discussion. This morning marked the first day of the 7th session of the High-Level Political Forum on Sustainable Development, where 47 countries will present their voluntary national reviews, sharing their experiences in implementing the 2030 Agenda. It is, as has been often said, a time for reflection. Since the establishment of the Programme on Aging last fall, our team has also engaged in an exercise of reflection. You see, the General Assembly has been calling for ensuring that issues of relevance to older persons are taken into account in the implementation of Agenda 2030, with the promise of leaving no one behind. But where did member states stand in responding to that call? We looked into it, and were surprised to find that 85% of the 111 voluntary national reviews presented between 2016 and 2018 included references to aging. You'll be able to read our analysis in the upcoming Secretary General's report to the General Assembly. But one thing that stood out was that older persons were predominantly addressed as a vulnerable group. In fact, we found that the majority of the voluntary national reviews portrayed aging-related issues as a challenge. For example, by focusing on concerns over sustainability of social services, pensions, and healthcare systems, and also as a factor that limits, and that's the exact word that was used, limits, long-term economic and income growth. Let's cut to the chase. We know well that the global population of persons aged 60 and over is rising rapidly. Less than 2 weeks ago, in a historic first, the G20 Osaka Leaders Declaration recognized the importance of promoting a healthy and active aging society. What is less understood is that population aging need not be framed only as a challenge or a risk or a burden. Such characterization stems from a culture of ageism and is a barrier to developing sound public policies on aging. The real question is rather, how do we seize the opportunities presented by aging societies? And just for a moment, let us put aside the matter of megatrends and acknowledge that regardless of the size of older populations, people retain the right to live in dignity as they age. It's high time we re-examine our approach to aging issues. And at this year's forum, especially because of the themes that have been selected, themes of equality, empowerment, and inclusiveness, we're calling for a paradigm shift that leverages aging as an opportunity and recognizes older persons as active agents who already make substantial contributions to development. And this cannot be achieved without confronting ageism, which is what our distinguished panelists gathered here will address. I anticipate a rich and lively dialogue, and I take this opportunity to welcome you once again. Thank you.
Thank you, Amal. So I'm going to take over at this point. We've got quite a short amount of time to get through a lot of inputs, so I'm going to keep it nipping along quite quickly. It's always a privilege to be asked to contribute in a small way to these sessions on ageing and older persons. It's an issue that I was engaged in quite a lot in the creation of the Agenda 2030 and the SDGs, and then since then through the work of the Institute that I head in Geneva, the UN Research Institute for Social Development, an issue that we're also committed to. So just briefly on the format, in a moment I'd like to turn to two supportive member states who are represented here today, Argentina and Chile. But first, with their permission, I'd also like to turn to Ashton Applewhite, who's sitting to the right of you, because you come to a lot of these UN meetings and you want to be energized, you want to come away with a sense that it's not just words. And we believe in inviting, and with her participation today, she can give us a bit of a boost to the start of this side event. She's renowned for writing and thinking about aging and older persons and discrimination against and the failure to acknowledge the proper contribution of people of all ages. She's the author of This Chair Rocks, which I was disappointed to learn is not a tribute to a lifelong dedication to moderating side events, but rather a manifesto against ageism. And so with that, Ashton, please, can you get us off to a rip-roaring start?
I can. May I have the clicker?
Where's the clicker?
The clicker. It's coming. Yes, the book is This Chair Rocks, a manifesto against ageism. I can say now that it is gratifying to be here. I spoke at the UN a few years ago saying that we needed to confront ageism, and now I can say that the movement is underway. The clicker is coming. So, in the Paleolithic era, the emergence of a third generation enabled modern humans to flourish, and the emergence of four, even 5 living generations is another tectonic shift. This permanent, global, unprecedented demographic change is occurring at a time of profound uncertainty. As political and corporate leaders pillage the planet and exploit deep divisions of race, class, and gender, we cannot afford to add age to the mix. The alternative is intergenerational solidarity, coming together at all ages to create a more equitable and inclusive future. That is the splendid vision at the heart of the 2030 Agenda for Sustainable Development's commitment to leave no one behind. This vision will only come about if we confront ageism, challenge the structures and systems that benefit from age bias and intergenerational conflict. Next. In the words of the Stakeholder Group on Aging, quote, "For leave no one behind to be taken seriously, the governments and other stakeholders must commit to a life course approach to implementing the SDGs, the Sustainable Development Goals. This life course approach means supporting people at both ends of the lifespan." I know there are people in the room here who are with the youth group. Ageism is any judgment on the basis of age, and younger people experience a lot of it. They, too, are falling through the cracks, although older people bear the brunt of age bias. Ageism is a key driver of social and economic disparities, and these add up over time, and they are further compounded by race and by class, preventing millions and millions of older people around the world from contributing to sustainable development. These older people, the fruit of the new longevity, represent a vast, unprecedented, and untapped resource. Dismantling ageism will unlock a wealth of economic and social capacity, both individually and collectively. Next. So it is gratifying to see real progress for older people in the SDG goals. But as Age Platform Europe observes, there is plenty of room for improvement, especially in lower and middle income countries, what Bangladeshi activist Shahidul Alam calls, more poetically, the majority world. And it is gratifying to see ending ageism on the list of priorities at this forum. But ending ageism is not just another line item. It must be an overarching priority in every domain: health, education, employment, women's rights, to name only a few. So let's look at a few of the goals to understand why. Next. SDG 4, lifelong learning. None of the 7 Goal 4 targets explicitly mentions older people. Why is this a concern? Because of entrenched bias, the ugly misconception that we older people are not teachable nor worth teaching. Older people learn differently, but we continue to learn, and we have both the need and the right to do so. For many, this means acquiring basic skills In Northern Africa, Sub-Saharan Africa, and Southern Asia, the vast majority of older people are illiterate. This is also a women's issue. Nearly 2/3 of those people who cannot read are women, and the percentage increases with age. Participating in all spheres of life and being able to do so for as long as we wish requires an education. Ongoing, lifelong access to training and retraining is increasingly important. Without it, it is impossible to become or remain an active agent in a rapidly digitizing and networked world. Next. SDG 8, decent work for all. Longer lives require working longer and saving more. And yet, a Eurobarometer survey found age bias more prevalent in the workplace than anywhere else. An OECD report showed that most employers in nearly all member countries had stereotypical views about older workers, which, needless to say, are negative. And not one of these stereotypes, that older workers are less productive, less dependable, less committed, less teachable, less creative, to name a few, has any basis. The persistence of these stereotypes makes it much harder for older people to stay employed and much harder to find work if we are let go. In the majority world, olders have a hard time getting small business loans, despite above-average repayment rates. Women, as ever, fare worse than men because we earn less, we're penalized for time spent out of the workforce, typically on unpaid caregiving, and we live longer. Age discrimination enables companies to exploit workers at both ends of the age spectrum, as in China, where tech companies are reluctant to hire people over age 30. This is not just an old people problem, because older people are more likely to balk at the 996 work schedule. That means 12 hours a day, 6 days a week for low wages, right? Is that the future of work? Not in a world that supports workers of all ages, right? That's what ageism does, allows people at both ends of the age spectrum to be exploited. This means enforcing the law, recognizing the many kinds of labor paid and unpaid that older people perform, and providing flexible and accessible working arrangements, which, of course, are good for workers of all ages. Next. SDG 3, healthy lives. This goal fails to include a specific target for older people. More problematically, Target 3.4 defines deaths that occur from non-communicable diseases, NCDs, before the age of 70 as premature. Where does that leave the rest of us? It allows governments to deny care to the vast majority of people who suffer from NCDs, heart disease, cancer, diabetes, lung disease, dementia. This glaringly stark example of age bias runs directly counter to the fundamental right to health established by the Universal Declaration of Human Rights 70 years ago. Despite these protections, ageism in medicine often means less care, worse care, and often no care at all. This spring, I got an email from a British medical student horrified by his peers' and professors' disinterest and disregard for older patients. Quote, how can a medical school that states it emphasizes person-centered care not see the importance of gerontology, the study of older people, and understanding ageism, he asked. This is London in 2019. Needless to say, conditions for older members of the majority world are worse. A 2018 report across 12 countries showed a growing gap between healthy life expectancy and life expectancy, the worst possible scenario, more years without health. Because of ageism, why should we accept a different standard of care for older people? It's that basic. Age bias also affects our health directly. People with more positive, which is to say more realistic, feelings about growing older walk faster. They're more likely to recover from severe disability completely. They live longer. The latest research shows they are less likely to develop Alzheimer's disease, even if they have the gene that predisposes them to the disease. That's why the World Health Organization is developing a global anti-ageism campaign to extend not just lifespan, but health span. Next. SDG 10, reduce inequality. Achieving this goal would not only narrow the gap between rich and poor, it would underpin the possibility of equal rights that do not diminish over our lifetimes. That's why the Stakeholder Group on Aging considers achieving Goal 10 a prerequisite to realizing all the SDGs, and needless to say, I agree. The absence of an internationally agreed upon standards and definitions makes age discrimination harder to establish and prosecute. As yet, there is no international agreement on the rights of older people. But would that be the best way to ensure that the protections now afforded separately to children and people with disabilities apply to all adults so that people of all ages could get help when they need it? At what age does someone stop being an adult and become an old person? Does the age keep changing as longevity increases? The real problem is not the shortcomings of international law. Laws don't shape behavior, they respond to it. The real problem is age discrimination. And that is why achieving Goal 10 and all the other goals will require nothing less than a mass movement to make ageism as unacceptable as any other prejudice. This movement is underway. Last fall, Australia launched a national anti-ageism campaign called Every Age Counts, and Age Platform Europe conducted a superb 60-day campaign that culminated in the 70th anniversary of the Universal Declaration of Human Rights. You'll find more examples in the campaigns section of Old School, oldschool.info, a clearinghouse of free, vetted anti-ageism resources. Next. This longevity is new. The roles and institutions around us were created when lives were shorter, and they haven't had time to catch up. And that means we have a critical window of opportunity to shape a world that supports people across the lifespan. We have tools to bring it about. The Stakeholder Group on Aging's position paper is peppered with examples of best practices from all over the world. We're adding more resources to Old School every month. And just last month, a Cornell University study showed that anti-ageism interventions are low cost, easy to replicate, and effective. Quote, "We know from past experience that these reports can be particularly effective at raising awareness, generating more political will on a topic, and providing an evidence-based framework for global and local action," said Alana Officer, who heads the WHO's campaign against ageism. Until we put a stop to it, ageism will oppress us all. That makes it a perfect target for collective advocacy and a unifying cause. And when we make the world a better place to grow old in, we make it a better place in which to be a woman, to have a disability, to be from somewhere else, to be queer, non-rich, non-white, a world that leaves no one behind, and the one we all hope to live long enough to inhabit. Thank you.
Thank you, Ashton. I'm very pleased that you finished on some positive notes of how you think this movement is emerging. And I think also we're going to hear from some of the panelists after presentations from Argentina and Chile about the contribution of institutions, of data and evidence, and the contribution of partnerships. I think that's going to give some extra weight to this emerging movement. But now let me turn to my right and to the support from the ambassador of Argentina, who has a long and distinguished career in diplomacy, but also, I think importantly for this group, is the co-chair of the group on aging. So please, Ambassador, the floor is yours.
Thank you. Thank you very much, Paul. And I'm very pleased to be here. And thank you very much for having me have been invited to deliver these remarks at this important side event in my capacity of chair of the open-ended working group on aging. I want to start thanking the Stakeholder Group on Aging, the United Nations Department of Economic and Social Affairs, DESA, and the NGO Committee on Aging for organizing this event, which will represent another opportunity to engage in a substantive and meaningful debate about the situation of the human rights of older persons and how effectively the 2030 Agenda addresses the challenges that older people face in our societies and their contribution to development. As has been said,
Move the microphone closer to the because some people cannot hear.
Okay. By the year 2050, older persons will be the highest growing age group globally. And according to the World Population Prospects 2019, published by DESA, the number of persons aged 80 years or over is projected to triple from 143 million in 2019 to 426 million in 2050. Therefore, it will be impossible to achieve sustainable and long-lasting development if we leave behind the fastest growing social group. Any strategy of sustainable development must include them as active subjects and agents of change. The maximum premise of the 2030 Agenda of leaving no one behind calls us for action to join our efforts so that the full exercise of the rights of the elderly is not only respected, but effectively guaranteed by the states. Addressing this global issue now will not only guarantee the protection of the human rights of the elderly, but it will also pave the way for states to be better prepared to face the future challenge of an ever faster growing aging population. This is a reality which imposes the crucial challenge of rethinking and redefining the way we see, conceive, and address aging. The 2030 Agenda makes explicit references to older people in SDG 2 regarding the eradication of hunger, and SDG 11, which aims at making cities and communities inclusive, safe, resilient, and sustainable. However, why do the SDGs related to health, gender, equality, employment, and education not address explicitly the specific situation of the elderly? The lack of visibility of older people in the 2030 Agenda could better be understood considering the following premise. In order to guarantee an age-inclusive implementation of the 2030 Agenda and the attainment of the Sustainable Development Goals, it is of utmost importance to be clear about the obligations of the states to assure the effective enjoyment of their human rights. In this regard, independent expert Mrs. Rosa Kornfeld-Matte, in her last reports, points that nowadays the lack of a wide and integrated international legally binding instrument when it comes to the promotion and protection of the human rights and dignity of older persons has strong practical implications. It is still very difficult to clearly establish the obligations of member states towards the human rights of the elderly, since the current legal framework does not work as a guide for governments and their governmental policies. This absence of a specific legal instrument by also explain the lack of attention to the specific problems of older persons in the global regulatory framework, in particular the Sustainable Development Goals. Distinguished friends, colleagues, I would like to take this opportunity to highlight the role of the open-ended Working Group on Aging, which is open to the participation of all UN member states, UN agencies, intergovernmental organizations, civil society, national human rights institutions, academia, the private sector, and other relevant actors with a clear purpose of enhancing the promotion and protection of the human rights of older persons. In this regard, I would like also to emphasize the relevant role played by civil society organizations, which have always been key actors in identifying areas where the human rights of the elderly need to be strengthened, pointing out the gaps in existing international framework and suggesting how best to address them. In conclusion, population aging is a global issue that needs to be addressed from a human rights-based approach. Only through the full exercise of civil, political, economical, social, and cultural rights, older persons will participate actively in society. That is why a universal, specific, and legally binding instrument will provide sufficient standards to ensure the full enjoyment of our rights during old age. In our working group, we are proud to have been recognized as the most prominent international forum specifically devoted to the rights of older persons. The working group has acted as a platform from which the wide and active participation of all the relevant stakeholders has given visibility to the need for promoting, protecting, and strengthening the human rights of the elderly, and has helped reflection open innovative courses of action that will best meet their current and future needs. It is undeniable that older persons can make a significant contribution to the social, economic, and sustainable development of their societies. If an enabling environment and adequate guarantees are in place, in that sense, it is imperative to fully empower older persons to allow them to effectively make that contribution, becoming not only recipients of special and social protection, but also specific rights holders and active, autonomous, and independent agents and beneficiaries of change. Thank you for your attention.
Thank you, Ambassador, for your leadership on the open-ended working group. First, I think you make a convincing case that we have a hard enough job already with the SDGs without systematically maintaining a discrimination against the older persons and the contribution that they can make across all of the SDGs and their targets. And I'm hoping when we get into the Q&A, we can also hear perhaps about how in Argentina itself, your government is also leading this agenda and making the institutional and policy shifts that will end discrimination. If I may turn now to our colleague from the Permanent Mission of Chile, Nazli Bernal Prado, who also has a distinguished and building career for her government. Nazli, please, do you also have some reflections of what you're doing in Chile, as well as the role that you can play in the multilateral sphere on helping to end age discrimination?
Thank you very much, Paul. Excellencies, distinguished guests, dear colleagues. First of all, allow me to thank the Stakeholder Group on Aging for organizing this event. It's an honor for me to participate on behalf of Chile and have the opportunity to share with you our policies on aging and the challenges represented by our growing aging population. As in an international experience, the way that countries have had to take on the challenges of implementing and monitoring the 2030 Agenda for the Sustainable Development is diverse. In the case of Chile, these challenges have involved a process of progressive steps in depth and scope in order to turn the agenda into a key roadmap for multi-stakeholder action aimed at sustainable development. At this point, I would like to highlight that this year, Chile will present its second voluntary national review, which is oriented, and we will appreciate a very strategic alliance between the public and the private sector in order to achieve or to advance in the achievement of the SDGs. Regarding aging, we are aware that we are in a critical situation now. Nowadays, Chile is one of the most aging countries in Latin America region. And this set us in a very challenging scenario because we are trying to achieve the development, but at the same time, we are trying to ensure the protection of human rights and fundamental freedoms of the older persons. In this regard, at the same time, we adopt the 2030 Agenda for Development Sustainable. In 2015, we signed, and 2 years later, we ratified the Inter-American Convention for the protection of the human rights of older persons. This convention provides us a very important framework for our public policies in order to face the issue of growing aging in our country. For example, it strengthens the social image of the older persons, safeguard their rights, strengthen public policies, and act in a timely manner and without discrimination, managing to prevent and sanction the actions of violence, abandonment, abuse that could affect the older persons in our country, and above all, to give a positive turn to the perception of society in general and the older persons themselves about or regarding this stage of life. With this convention, I would like to briefly refer to our 4 focus in our public policies regarding aging. Our policies are mainly focused in 4 areas: is health, security, participation, and institutionality. In general terms, in health, we are very conscious and progress is being made in increasing the coverage of the National Health Plan, that specifically for the needs of the older persons. Also, we are very interested in to increase, as our panelist also said, in increase the number of geriatricians, and mainly in the creation of geriatric acute care units, because we know that there is not, the population, the aging population is growing, and we don't have specific professionals in order to attend these needs. Also, we are aware about a social security reform in terms of security. And in health also, I would like to point out that we are very in line with the initiative of the World Health Organization, which is a decade of healthy aging that will start in 2020 to 2030. Then the second point, as I said, is security. In security, we are thinking about a reform of the pension system. This is in considering aiming at increase the pensions of older persons. Also, we are interested in to implement a social dependence insurance and strengthening the national network of the day centers and the establishments for long stay for the elderly. Establishment that people were stayed and also consider some independence if they are there. And in terms of participation, the older person is fundamental to exercise their rights. So why is programs that contribute to the promotion of their autonomy are being strengthened? And the generation also a space for participation, and not least advancing mechanisms that allows a real formal labor participation of the elderly if the people wishes to continue to working, but in good conditions. The last axe of our public policies is institutionality, where we strengthen the work of the National Service for the Older People, that is called SENAMA. It depends from the Minister of Social Development and Family. And also we are thinking about the figure of an ombudsman for the older persons, who will be a lawyer specialized in issues of human rights and the older persons, who will work along with the SENAMA service. Finally, I would like to highlight another relevant issue that is, we are aware that we have programs, policies, but we would like to go beyond this and pass a bill that will have a structure that will provide some framework to strengthen some main areas where we still have gaps with the convention. We are very proud that we have some programs, but we think that it's time also that this was stipulated in a Chilean law. Finally, I would like also to mention and highlight that the issues of aging in Chile now counts with support of our First Lady, that he came 2 years ago here to present in a side event the program that they are implemented that is called Positive Aging. And now they are also engaged in a program that is called Better Adult, in order to culturally change the vision of the society and as older persons themselves have about themselves, and consider the value in a stakeholder with other ministers also to provide, as I said, better conditions for another vision for the older people. Finally, if I may, I would like to invite you for the next Monday, 15, to a side event where authorities from my government will present the Compromiso País, that is the social policy with the stakeholders. Thank you.
Thank you, Ms. Bernard-Prada. I think especially for the concrete national policy shifts that you're undertaking at the country level, which I'm sure everyone will appreciate are not easy. When you're trying to go from A to B, you have to think about resources. If you're reforming social security and pensions, you have to think about political leadership. You have to think about the mindset of how your people and population approach this, because ultimately they give you the mandate to make policy shifts in government or not. So, but it's very interesting to hear what you're actually doing at the country level. In the next segment, we're going to hear some interventions from colleagues in the UN system and also practitioners beyond about how they're approaching, I think, some of the constraints that prevent getting rid of age bias and age discrimination. And first of all, we're going to hear from Mr. Eli Mugaboashima, who's the Executive Director and founder of Nsindigiza, which is an institution based in Rwanda. So, Eli, over to you. I've been guided, I must say, to urge you to keep the contributions as short as possible for Q&A at the end. Of course, I know that you've also put a lot of time into your presentations, but if you can find an accommodating balance, then we'd be very grateful. Thank you.
Yeah, thank you, moderator. And I'm happy to be here today. As he said, I'm from the country of Rwanda, where if we talk about SDGs, it means youth and children, women, and the people with disabilities. And that's all. So if you allow me, let's start by this quote. Next. From one woman who participated in the Living On Behind the National Dialogue. And when she was given an opportunity to speak, she says, being older woman with disability in a rural area is a multiple burden. That is just what she said. That was just to summarize her feelings, because having all this with you was really a big problem. Though she was a woman, but being older was a big problem. At least the rest is taken care of. Next. Another quote concerning the SDG 3 on health. Here also we were in a tripartite meeting with stakeholders, and one other person said, one day I went to the hospital, the doctor said that there is not enough medicines, so what they have should be given to young people who was next to him. Because he said, okay, now when there is not enough medicine, the priority is young person. And that one is understandable. They think that there is no problem. Next. Concerning education, I have two quotes. So one said, I'm left behind when it comes to technology. It's even difficult to use my cell phone and the television. Rwanda is one of the countries where technology is moving faster. So young people, they use just technology, but there is nothing organized for other people. And also, another one said, I need skills and knowledge in learning to write and lead so I can access information. Because one of the problem or issue facing other people is not having information. They are isolated, they are alone, they are depressed. Next. So as the solution, there are two approaches. One is partnership among different stakeholders. The second one is capacity building. Concerning partnership, when we saw that there are some people who are privileged, we opted to join them so that we can raise voice together. So we started Rwanda Leaving One Behind Network, working with other people with disabilities, historically marginalized people, women, and others. And we started to conduct consultations with other people and organize local and national dialogues and conducting awareness raising in collaboration with different or other existing mechanisms, and in partnership with the government and the human rights institutions, other people, and other CSOs. Yes. Concerning the capacity building for other people, what we do is because there is no formal education for them, so we encourage them to come together and form the early support groups and organize meetings for other people with key policymakers, and we accompany them to know how to express their views, and also to accompany other people in organizing tripartite meetings with the stakeholders so that they can share their views, and each one should understand what it is our responsibility. So if the head of state said none of the SDGs will be considered met unless met for all, what about other people? Thank you.
Thank you very much, Ellie, and especially for being very concise in your presentation. Now, next I'm going to turn immediately to my left to Caroline Schmidt, who's the... I don't think this is the right title, and I just reached for it, and it's not the correct one, is it? We've not changed this yet. But Chief of Fertility and Population Aging. That's right. It's the Chief of Fertility and Population Aging in DESA's Population Division. But Caroline, thank you.
Paul, and thank you to the Stakeholder Group on Aging for organizing the panel, and I think it's a very important one. Ageism is everywhere. It's not only a niche somewhere in some parts of the world, it's everywhere, and I think all of us see it in the developing countries. It is prevalent, and I think what I tried to do in my 7 minutes, how do I convey a message in 7 minutes, and I hope I can stick to that. Sometimes you get too passionate and you talk too long, but I would try to stick to it. So what I do is present a few key findings on the survey we have conducted 2 years ago in Malawi. I headed a project that aimed to develop a survey instrument for sub-Saharan Africa to assess the situation of older persons. Next slide, please. Okay, what I want to do is bust some myths, and the second is I want to also provide some evidence, because yes, we have to debunk some myths, but we also have to collect evidence to really see what is happening and what needs to be addressed. Next, please. Okay, myth number one: older persons are economically dependent. We all have heard that, but the fact is, and I'm drawing now on the results of the survey, older persons contribute to work And in sub-Saharan Africa, we know most of the work is informal work conducted in agriculture. The numbers speak for themselves. We have about 70% of older persons were engaged to some extent in agriculture work. Over 2 in 3 persons who reported even to be in poor health continued to work. And 30%, so more than each third person, provided substantive financial support to a family member suffering from HIV/AIDS. I think we have to let this sink in to really understand what is happening on the ground. Next, please. Myth number 2, older persons are dependent on health care. Fact, older persons are major care providers. 80% of older persons reported to care for other older persons. We all know that somebody, a lot of, again, it's a gender aspect, women at the age 60 take care of either older spouses and or older parents, and they also take care of children and grandchildren. Next finding is 7 in 10 older persons were primary caregivers offering HIV/AIDS related support to a family member. And 34% provide care to orphans under age 18, HIV/AIDS related orphans. Next, please. Myth number 3, older persons are frail and are in bad health. Fact, older persons are quite often in very good health. Of course, the survey did not do a medical assessment, but what we did is we asked older persons a set of questions to assess their own health condition. And 40% of older persons reported to be in good health, 15% said to be in very good health, and 3% reported to be in an excellent state of health. So that means more than 50, almost 60% of older persons interviewed said to be in fine health. Next, please. And then the other side of the coin is, of course, we also have to find out what is really happening on the ground. And, of course, we can't do a cause-effect analysis, but what I'm describing now can be symptoms of ageism and can be cause. So the fact number 1, we know education and poverty, there are gender gaps. If we look at the distribution of income quintiles among older persons as head of households, we know that more women than men are poorer. We also saw that with respect to education attainment, 41% of older persons had no education, and that speaks to what Ashton said, that there is no reason why older persons should not get some education, and there's lots of room for improvement to do that. And it also shows a gender gap that, of course, that is the results of discrimination against women over many generations. Next slide, please. Another fact is, whoever works in sub-Saharan Africa knows that older persons particularly suffer from food insecurity. And a lot of older persons employed several mechanisms to avert the hunger situation. And it's shocking to find that 93% of households with older persons skipped or limited the number of meals as a coping strategy. Of course, we do not know what is the cause of that. Is it that they were not given food because they were old? Or that they said, I can skip a meal or two because my grandchildren need to eat? Another, more than 50% said that they ate every month less food than they felt they should because there wasn't enough food. And 13% of older persons ate less monthly because there was not enough food. And more than half could not afford food occasionally. Fact number 3. Healthcare and care provision at times is not appropriate. We heard that the situation in Rwanda, Malawi is not different. Well, generally people said we get reasonable, good health care, but we know it's not always older person friendly. We also know there's not often medication available to treat issues related to diseases, illnesses of older persons. And the distance can be a challenge because if you have a problem with mobility and you don't have access to transportation, you can't get there. Next, please. Abuse is prevalent. We found of those who respond, and of course asking these questions is often a challenge because people might not respond even if we secured confidentiality. So what we have here is scratching on the surface, but it shows that more than each third person said emotional and psychological abuse to have experienced that. The same share older men as older women reported that they were mistreated in the previous 12 months. And psychological and emotional abuse is prevalent as well. Next, please. So what needs to be done? To walk away with 5 points. I think we need to include older persons themselves, because often we do proxy interviews and we hear what other people say about these elderly, and that's not always the truth on the ground. Second, we have to include older persons in the conversation to really understand what are the issues and how to address those. It's not nothing about us without us. And more research is needed that focuses on older persons themselves, as I said before, not proxy interviews. And of course, it's always critical to understand social, cultural, and economic background. And last but not least, there is no one-size-fits-all approach. Thank you.
Thank you, Karin. I should have mentioned, I think, at the beginning, because it's important that as part of your responsibilities in DESE, you are a member of the steering committee of the Titchfield City Group on Ageing and Age Disaggregated Data that aims to build international standards and methods for the compilation of statistics and data on the major dimensions of ageing. So, of course, it's a very important piece of work, as you explained, partly to dispel myths, but also to put a number on significant challenges that actually are real and do remain. So we've got one more short presentation first, and I'll introduce Moanne in a second. We're going to have a very condensed Q&A session. I'm going to ask, I think, one general question to all the panelists, and it'll be about what they see as the major constraint, whether it's resources, policies, legislation, data and evidence, partnerships, capacity. And you can say all of them, but in a way, what I want you to do is from where you sit, what is the major constraint? And after Moanne's presentation, I want also maybe 2 or 3 questions from the floor, if I can. Short, sharp questions or comments if you can, but no long statements for individual panelists or something for all of them as well, just to forewarn you in advance. So our last presentation is going to be from Moanne Genevi, who works for an institution called Equinet based in Brussels, and it's a European network of equality bodies. So Moanne, thank you.
Thank you, Paul, and thank you. We are very honored to receive the invitation of the Stakeholder Group on aging to address ageism, because that's also a topic that Equinet addresses quite actively. What is Equinet? We are, as you were saying, a membership organization, and we work and we represent a very particular type of organizations, which is not necessarily yet in the radar of the UN system, but should be. And because we are very relevant for achieving SDGs, and in particular SDG 10, we are not civil society, and we are not government either. We are in kind of a space in between. We are equality bodies. So next slide. Equinet represents 49 equality bodies in Europe. And due to European Union law, every member state of the European Union has to have an equality body, at least in their country. Equality body can be also ombudspersons, national human rights institutions, but equality body can be standalone institutions by themselves. And it's not only a European mechanism. There are equality bodies in Latin America and in the US. We've worked with them, and probably in other countries as well. Next slide. So equality bodies are a very specific type of independent institutions, which seem to be kind of tailored to implement and achieve Goal 10. For the next slide. Equality bodies are central actors of change when it comes to achieving equality. Their main task is to assist victims of discriminations on many, many grounds, but including the ground of age when it comes to employment all over Europe. So they foster individual change by directly assisting victims of discrimination, but they also foster organizational change because equality bodies are mandated to advise and promote good practices on equalities for employers, service providers, and policymakers. Equality bodies have the mandate to provide recommendations to government and to gather equality data as well. And finally, equality bodies foster social change because they have the mandate often to communicate on equality and to do campaigns, including on age discrimination, for example. So they foster a social change by promoting equality as a central value. And one of the grounds on which all of our members work, because it's in EU law, it's in an EU directive for employment, it's age discrimination. So in the next slide, I'm introducing a report that Equinet has issued on fighting discrimination on the ground of age. And it's a good example of the potential of equality bodies and their work on this one particular ground. And all the findings we've done are based on the case law that our members are doing, and also on the studies and the surveys they are doing in many countries. So this means that equality bodies are a very valuable source of data and knowledge when it comes to age discrimination. One of the key issues we have in our report is the lack of comprehensive legal protection, because in the EU, age discrimination is only prohibited for employment, not when it comes to health, for example, or housing or access to goods and services. Then some member states do it, but it's not a comprehensive EU law to protect older people against that type of discrimination. It's also often age discrimination is also portrayed as less severe, but in many surveys done by our members in Belgium, for example, Hungary, Norway, etc., older age groups are identified as having the highest risks of discrimination. What's also interesting to note in this report is that courts are often reluctant to require an individualized approach, and they seem sometimes even ready to accept the use of certain generalizations, so statistics, for example, and stereotypes connected with age to rule for cases, rather than having what case-to-case approach, and this is to kind of a form of judicial stereotyping when it comes to age. Also, sometimes in legislation and public policy, there is cases of age discriminations which reflect the reality of deeply ingrained stereotypes linked to age, even in policy making. Another key issue of the report is the prevalence of multiple discrimination, which, as was said before, a form of multiple burden that some older persons face, because older persons are not a homogeneous group. They're made of many people. And it's our members identified most cases on gender, with, for example, different retirement age, also provisions of loans for women which are capped at the age 63, for example, in Romania, and 65 for men. There are even differences in that case. And finally, one of the key issues identified was the use of new technologies, and how sometimes even intelligence, artificial and algorithm based on criteria such as age can lead to discrimination. For example, when calculating the potential of accessing to a loan, then older persons can be discriminated. So these are all the key issues. I had more detail, but I'm going to stop here and then we'll talk afterwards.
So I hope you've had your thinking caps on and that you've got some short, sharp questions you'd like to ask the panelists. So I'm going to call on the gentleman there first. Generically, if you can just introduce your name, who you work for, that's it, and then your question. And if it's aimed at a specific panelist, then just indicate that. Thank you.
Good afternoon. Thank you so much for giving me the opportunity to ask a question. Good afternoon. My name is Valentin Camano. I'm a UN Youth Representative for Man Up campaign. And my question to whoever can speak, for example, some of you panelists mentioned education, training, lifelong learning, and capacity building. How can other member states than the ones that presently are effectively implementing these recommendations suggested at the recent Aging Conference Forum, making sure that their human rights are recognized through all sectors? That is my question. Thank you.
Thank you. So we'll take one here and then...
With International Council for Adult Education and Education Academia Stakeholder Group. I would like to make two short comments and ask a question. First comment is about the shocking fact that to see that our Agenda 2030, is still leaving large groups behind. And of course, older people are one of them, but for the agenda that has the motto, no one left behind, it's really shocking. And the fact that we need to explain that dignity means dignity, a life with dignity means dignity for all. It's again, I believe, shocking. Prioritizing dignity of one group of people over the other, this is something that means that we don't mean it seriously with no one left behind. So when it comes to the concrete issues and when we check the agenda, usually older peoples are added. It's like addendum for everyone, including older. So just add it. I think this no one left behind, including older people, should be a basic principle, and that's what we should insist on, and not be satisfied simply by adding older people on the end. And now focusing on education, this is a kind of a trap that I would like you to comment. Of course, lifelong learning is there, and lifelong learning means from cradle to grave. But if we check closely, even Agenda Education 2030, older people are not there. So we don't really mean it seriously with lifelong learning. And there is this prioritization. Of course, everyone will recognize, or at least rhetorically say, yes, education, lifelong learning is right for everyone. And we are talking about rights that are not negotiable. So we talk about the rights that older people have earned. So, of course, no one will be against. But if you check the programs, if you check the financing, if you check the data collection, anything related to education and learning, we will see that older people are not including. And I think it's a kind of a trap, this false dichotomy. Oh, you know, we have to prioritize, and of course we will prioritize children, early education and children and youth. We have good arguments or excuses for that. I think it's a false dichotomy. And we need approaches that will include all. So this will be one question, and the other one very briefly. There are so much talks about urgency of the agenda. You have heard last year, a Secretary General was talking about a few years that we have, considering climate changes, but many other issues as well. And in the education, and lifelong learning, we still prioritize early childhood, children and youth. So isn't it the discrepancy? So why don't we invest additionally to the education of adults and older people if the time is really running out? I mean, even 2030 is around the corner. So how would you explain this discrepancy in the approach? Thank you.
So I see a hand there and one here. So we'll take those two. So Kathy and then Sue, I think it is, isn't it? Yeah.
Catherine Klein with the International Network for the Prevention of Elder Abuse, and my question's addressed to you, Ambassador. Sir, I remember, and I'm sure you do too, your colleague Ariel stood before one of the open-ended working group sessions went through the list of all the conventions for everyone except older persons, and then he stood quietly after having asked, "So what do you have against older persons?" And I wondered if you have any sense of why member states persist after, 10 sessions of getting lots of information about the gaps, as we heard in the panel today, that require a convention. Why does this still persist? Thank you.
Thank you, Kathy. Sue.
Thank you. My name is Sue Lee, and I'm here representing the Stakeholder Group of Persons with Disabilities, and I just want to make 2 comments. One is to build off that comment. We are willing and absolutely able to provide any support for the convention in whatever stage it is and whatever work it needs to go forward, and we're especially happy to work on any issues that we have in common, including accessibility. Second comment is to just remember to reemphasize the importance of diversity in aging and to not use a one-size-fits-all policy, because people with lifelong disabilities, for example, face issues around aging that are different than people who become disabled at older ages. And therefore saying that we have a policy at 65 or 60 may not be appropriate. So just to reemphasize that importance. Thank you.
Thank you very much. So now I'm going to come back to the panelists. I'm going to go from left to right, if I may. So you may choose to address 1 or 2 or none of the questions from the floor if you don't feel that you've got anything to add. And then my one question to you before that was, of course, everything is important, but where do you see the main constraint for adding momentum to the emerging movement to get rid of age discrimination and allow people to contribute to sustainable development? So, Ellie, please, the floor is yours. Just for short responses, of course.
Yeah, thank you. Okay, what I can say is that all the people, they can be agents of change. That is absolute, because they have enough to give to younger generations. Concerning education, here I want to say that there are 3 forms of education. There's the formal education, informal, and the non-formal. So education is not necessarily formal education. So what I can say is that in Rwanda we have education policy, and now we have inclusive education. But when you talk of inclusive education policy, it means that there are boys and girls, and then children with disabilities. But children with disabilities, they say that, but there is no means for them. So when it goes to education for children with disabilities, just it is for physical disability. So it is where I want to say maybe what we can say, or our advocacy, is not just to focus on formal education, but also informal and non-formal education, so all the people also can benefit from education for all. Thank you.
Thank you. I would also like to react on the comment on education, because it's true that when we drafted this report on fighting discrimination based on age, we had trouble to find cases on education, not because there are none, because there are, but because they are not reported, and that's something that in general is we need more cases to advance on legislation and protection of older persons, because recently with Equinet we organized a seminar with the Age platform, which is the European platform of organizations of older persons. And then we discussed with people who told us that there are cases of older persons not, for example, having a grant for a PhD, being denied a grant for a PhD because they are considered too old. So there are cases, but they just need to be reported to court, and they need, and so that's how we're gonna advance and reach the persons that are further behind. And when it comes to how to do in general, how to reach what could be the contribution of equality bodies. It's exactly that. It's building partnerships. Our members are able to advance legislation, to collect data, and to advise governments on going further when it comes to fighting discrimination based on age. But for doing that, we need to have strong partnerships with civil society organizations who are in contact with older persons and know the cases and have the trust and the good relationship with the people that are the most affected by this form of discrimination. So that's where our contribution can be essential.
Very brief, I fully agree what the previous two speakers said on education, but I would like to be a bit more on a positive note. I think we all know labor markets are becoming more flexible. We are no longer going to school 9 years, then we have a job for 20, 30, 40 years, and then we happily retire. I think the pension was something we had for the last 100 years, and the next 100 years, I guess, most of the kids now going to school, they will not get the kind of pension we all in this room hope to get. So based on that, I would say education. Living longer, we have to distinguish. We have older persons and we have the aging process. So meaning aging is not only, and that's what I'm telling people, is not only adding 10 or 15 years at the end of your life. That will have considerable changes for the entire life cycle. And that is something I think that cannot be stopped. And there are initiatives where you see there's education, there's training offered for later in life. You change career in the mid or later in life. So I think that is something that is going to happen. But of course, we have to now look at the situation of person that by the age of 40 or 50 who want to do a PhD, who want to say, I want a different career. How do I get it? How do I finance it? So I wanted to make these 2 points. And then the other issues, of course, being a demographer, I would always say numbers, and we need empirical evidence. Anything we say to make a case, we need the figures. We have to at least prove, because some people, if you talk to the Minister of Finance, yes, you can. It's important to have hardcore numbers, to have figures, so they would have to hold something against it. So I would definitely say that is what I try to prove, is really bring the facts, talk specific issues, understand the culture, and yeah, let's not give up.
Thank you. Well, I received a very concrete and direct question that I thank you very much, because this sense of this working group of aging, one of the mandates and the meaning that we meet every year for 4 days and in a working group with more and more member states participating, more NGOs, more civil society, means that we are going in the correct direction. And why we don't have at the moment any possibility to have a binding instrument as some other vulnerable groups have. For example, there's a convention on the rights of the child, there's a convention for persons with disabilities, there's a convention for discrimination of women, there's a convention, a lot of conventions. And why we don't have a convention for older people? And that's a very good question. And because there is a lack of commitment of many of the member states of this organization to have a binding instrument that obliges them to respect this vulnerable group. So easy. And most of those countries are developed countries, not developing countries, developed countries, because they don't want to have a binding instrument to apply them to, first, to have local domestic legislation that will rule the older people. Second, because most of the problems that developing countries faces here in the world, in the UN, is the lack of resources. And they don't want to finance those developing countries to reach the obligations of this convention. The same happened with the Convention on Persons with Disabilities some years ago. How many years the Working Group on Disabilities had meetings here in the UN? A lot of years. until they decided to start drafting a convention. It took some time. We have met in the last 10 years, almost 10 years, since 2010 in this working group, and we have made progress. I hope that in the next session, on April 2020, we're going to have an outcome for the first time. I hope so, with the help of DESA, with the help of the High Commissioner of Human Rights, and I'm sure that we are going in the right direction. That we need is more lobbying of the NGOs, civil society, the governments, and the developing countries should start facing that this is a problem also for the countries, that maybe the aging is not such a problem as some from other countries. So it's a question to start moving all together and try to support this working group so we can have in a few years more really a convention related to the older person. Thank you.
Thank you. In the same line that expressed Ambassador Martín García, I would like also to mention that we are some group of friends that is now chaired by Chile, that it's include 25 member states and NGOs and also some observers as UNDESA and the Office of Human Rights, that we are collaborating and also trying to advance in this idea of finalize with a convention of the human about the rights of the older person. So that is our wish, and we are supporting the work of the ended work working on aging in this proposal. And related to education, we consider also that it's very important to take in mind all the groups. All are very, because we need to think about the future. In Chile, for example, we are some young people that not finished the compulsory education. So we need to monitor all the educational system, and of course to provide some options for the older people in training, maybe inside the enterprises. I remember in my country, the training was until allowed to 60 years old. People more than 60 years old doesn't allow to take some training. Now there is a normative and a law that will allow that people beyond this age can also continue training. Thank you very much.
Two comments. I was grateful for the comment from the woman representing persons with disabilities. The overlap between ageism and ableism often goes undiscussed. I think people are made nervous about it. And of course, also the enormous heterogeneity of both conditions. What the activists who got the ADA, the Americans with Disabilities Act passed, did so brilliantly was to change disability, the way we saw it, from a personal misfortune to a social problem that could be dealt with collectively. The example being, the problem is not that I'm in a wheelchair, the problem is that there are stairs between me and where I want to go. That is what we need to do with aging, to change it from this personal problem to a social problem. So I think we have a lot to learn from working together, and I'd like to see more of that. On the education question, which I see relating to work and, of course, also to participation in the larger world, I want to point out that the ADEA, the American Discrimination in Employment Act, here kicks in at age 40. We are looking here so often when it comes to education and access to opportunity at people who are 40, even 30, as I mentioned in China, who are 1/3 of the way through their lives, perhaps halfway through their working lives. Aging is not just something annoying that old people do. It is a process that we embark on the day we're born, and I think it's really important to remember that these policies affect people over half or 2/3 of our lives.
Thank you, Ashton. So I'm going to hand over in 1 minute to Erica Darf to close the meeting. But before I do that, can we just give a round of applause for the presentations and also the... Erica to close. Thank you.
Thank you, Paul. just to say, on behalf of the Stakeholder Group on Aging, I'd like to first of all introduce my co-chair, Mariana Raj, who's from HelpAge International, who is taking the place of Verity from HelpAge International. So, Mariana, thank you. And as you know, I'm from AARP, but just to say, we couldn't be more thrilled at a most diverse group of speakers and the passion with which you address the subject. All of you have made a point of making people who may not be aware of the issue of ageism aware. And I'm hoping, yes, Ashton, we need that movement. And it started. And, you know, if people in this room are not that familiar with the position paper that Ashton referenced, we have copies, and we'd be happy to distribute them to you, to have you go into your meetings at the HLPF this week and to raise the points that have been raised here. Ambassador, you know the convention is something that the Global Alliance on the Rights of Older Persons, the Stakeholder Group on Aging, even though that we're working on the development issues, rights is a development issue. Craig Mogkaiber from OHC, the Office of the Human Rights Commissioner, always says that. Member states who are talking about SDGs and have to be aware that they are leaving older persons behind, and we appreciate the work that your government and Chile are doing. And of course, DESA, data, and hats off to you, Caroline, for the work that you do and the work that you do in the field. And, you know, as the figures show, there is ageism. We have to debunk the myths that are up there. And I'm so pleased to have Equinet with us, a new partner. We are with you to help you with anything you need. We are now, I'm proud to say, 15 organizations as part of the Stakeholder Group on Aging. We grow, you know, in small increments, but we are a strong group. So please, you know, reach out to us. And of course, Ellie, for sharing Rwanda. But disabilities, we've been working with you from the beginning on the whole issue of SDGs. So thank you again for supporting our convention, and we are, you know, partners going forward. Thank you. And education, thank you for your comments. And on that note, I'd like to thank Paul Ladd for a brilliant job on moderating. And thank you all for coming, and let's give our speakers and panel a round of applause.